All right. Hey, everybody. So, welcome to this special edition of our interview series. Today, I just figured, we'll have my colleague, Dr. Kelly, here join us because, hey, Kelly,
Hey, good.
how's it going?
How are you, Zach?
Doing good. We're pretending like we weren't just talking to each other. So the reason I wanted to do this is because we always get a lot of questions about different types of things that we do at CHB. One of the big ones lately, and this was something Kelly mentioned to me, was dry needling. And dry needling, it's one of those big things that we see in the physical therapy profession these days. A lot of people have questions about that. Maybe you who are watching this has questions about it too. And I can understand why they would be. Who are these crazy people that are taking out these needles and wanting to stab me and say that it is going to help with X, Y, or Z? I probably should ask some questions too. So Kelly, she is our dry needling expert and the clinic director of our McLean facility. So I said, hey, you know what? Let's just have her on here. I'll ask some of the questions I've heard, give some insights because I used to do a lot of it. Can't say I do it so much anymore because people like Kelly have basically kicked me out of the clinic and told me that we don't need you anymore. So with that being said, Kelly, if you could fill me in, just tell us, what is dry needling? Is it snake oil? Does it actually help? And if it does help, how does it work?
Yeah, that's a great question, and I get this all the time. Usually followed up with, "Is this acupuncture?" The answer is no. It's not acupuncture. We use the same needles that an acupuncturist uses, but the concept is a bit different. So, the really small microfilament needles. They go into your skin, and they're aiming to stimulate the underlying trigger points. So we're looking for things that you might describe as a knot or tight parts of your muscle or connective tissues that are potentially causing your pain or causing some of your symptoms. So once the needle goes into your skin, it will stimulate a localized, what we call a twitch response. So you'll feel that muscle contract, and then it should be followed by a relaxation. And it can also stimulate a nervous system response, and that can help inhibit your pain signals as well.
Gotcha. Appreciate sharing that. And then
Yeah.
when you say the twitch response, do you mean more of a lot? I know the term trigger points is out there. Is that
Mhm.
what you're talking about?
Yeah, sort of. So it may twitch right where the needle is. It may twitch somewhere further away. So as you know, our muscles are pretty big, and just because someone has a trigger point or I'm targeting a muscle in one place, it might react in a different one because of where the connections of the muscles are. So if the trigger point is in the center of your back, you could feel a twitch lower or higher, just depending on what we're hitting and what's being stimulated.
Gotcha. And this is funny because I remember when I took my dry needling courses, like maybe 10 years ago, which is ancient in this field. The courses we took, they integrated a little bit of Eastern, Western kind of medicine into it. And so a lot of it was, and the rationale I remember they used was we're trying to create a lesion in the muscle or the tissue or whatever you're going after. The lesion or the little mini tearing you're creating stimulates a healing response to trigger the body. Hey, heal the tissue. I know that's a little different than the twitch response. Um,
Mhm.
so, what I guess what is the? So can you tell me a little more about why you chase the twitch response, and if you go after some of those other reasons or look at it from the other perspective as well.
Sure, yeah. And that's kind of a loaded question. So you don't necessarily need a twitch response for the dry needling to be successful. It's just kind of nice to have and that green light signal that's like, oh, okay, I did find a sensitive area. The reason why we go for that twitch response is it indicates that that was a spot of neural hypersensitivity. So your muscle being at this low threshold contraction that you're not controlling, it's involuntary. It's just happening for whatever reason. It could be protective. It could just be something that has grown over time. But the twitch response allows for a large increase in neural input. And then after that, it decreases, and that gives you that kind of relaxation. When we aren't getting a twitch response, so kind of like what you were describing is those little tiny micro tears from the needle. And I describe this to patients sometimes if they don't get that twitch response. You can feel the tension on the needle relax. So the muscle is going to kind of grab onto that needle as you do the pistoning technique, what we call it, so moving in and out of the muscle. You can feel that muscle kind of let go as well. So similar to what you were just describing is you stimulate that healing response to the area.
Gotcha. Cool. So the long story short is, if I just want to know, hey, what does it do? Needle goes in, can get stuff to relax. There's a whole mechanism of how that happens. And then also it tells the body, hey, heal this area, do good things. Long story short, that's a lot of what we're chasing. So if you're looking for, like, the dry needling for dummies edition, that's the if anybody actually knows what I'm talking about with those old books, that's what we're talking about there. So now, how do you determine, like, if dry needling is right for somebody and if it's not right for somebody? So what should, if I'm a patient, like, how do I know if I'm a good candidate or not?
Sure. So there's easy few questions to eliminate you from being a dry needle candidate. So those things are going to be if you're on blood thinners, if you're pregnant, or if you're immunocompromised. So those are a big three kind of red flag questions. If you fall in any of those boxes, it's not worth it to try dry needling. The risks behind that are greater than the rewards we could potentially get. When I do decide to do dry needling on my patients, so I look for a few different symptoms they may describe. So if there's range of motion restrictions that seem to be muscular, if someone has a feeling of tightness, or that's one of their main symptoms, is describing this knot that just won't go away. I'll often do it on people who cramp easily. So examples with my runners, they have calves that they can't make it through a run before it starts cramping. We'll try the dry needling. Or any other kind of dull, achy pain that in the course we learned it as your myofascial pain. So a pain that's difficult to localize, that's dull and achy, but doesn't really follow any of the signs and symptoms of a bone or a muscle, joint injury.
Gotcha. That's super helpful. And I remember and I know some of the good things about dry needling is, right, you can have that very localized response, and you get some of the global effects as well. Of just, again, the body going through its healing process. So you mentioned some particular injuries and situations that might be helpful for dry needling. Are there any particular, it's a little bit of an extension of the last question. Are there any particular areas of the body, any particular, maybe could be diagnoses, could be injuries, people, wherever it takes you, that you've noticed respond really well to this stuff?
Sure. That's a great question. And I have needled a lot of things in the past few months here. So I would say most commonly, I've been doing a lot of upper trap recently. So people with neck or shoulder pain, or kind of feeling this tightness up in here. The upper trap tends to respond really, really well to dry needling. It's very excitable. There's a lot of neural input. And I've gotten really good results for specifically neck pain patients going after that. I've also been doing the glutes pretty recently. Quads and calves are probably the next most common ones. So needling the glutes and the hip musculature can help with hip tightness, or sometimes low back pain if it's something that is coming from the hips or the glutes. And then that runner's example with the calves are pretty excitable as well. And that I use if there's any ankle restrictions, or if someone's having trouble with cramping, I'll try dry needling of the calves. And then the quads, probably the next most common one. I've been using for a lot of ACL rehab recently, actually, and more like acute knee pain. So tightness right above or right below the kneecap, patellar tendonitis, those kinds of things I've gotten some good results for needling the quads then.
Oh, Mike, yeah, appreciate you sharing that. So a lot
Yeah.
of different areas that needling
Yeah, everywhere.
can help with for sure. And yeah, I know it can I know there's been a lot of runners specifically get some real help with this stuff. I know from what I've seen, and those chronic back pains things are helpful too. And really good point about like the neck pain as well. I mean, that's pretty common these days with all the computer work we do and things like that. And so that's great to know. And now I'm sure what a lot of people are wondering if they've never had this done. I know, I think back to when I took the course back again 10 years ago, and we were talking about all the science and behind dry needling and why it's so great and all these things. And I knew we were going to be testing all the techniques on each other after the fact. So I remember all I was thinking about that whole time was, is this going to hurt? So, so I'm going to ask you the same question, Kelly. Does it hurt?
The short answer, it's definitely very uncomfortable. I think everyone has their own threshold for pain. So me personally, I thought it hurt. But if it's something that I can go a weekend and have my whole body dry needled and be okay with it, then I know probably any of my patients can handle it because I've got a pretty low threshold for pain. So how I describe it often is like a deep muscle cramp. And the good thing about dry needling is if you want the pain to stop, if it's too much, you can say stop, the needle comes out, and that pain goes away immediately. So there is some soreness afterwards, but it's more of a muscle soreness, kind of like you just got a vaccination or a shot. But the actual process, yes, it's uncomfortable at the time, but it can stop immediately if you needed to. And I will say 99% of my patients have handled it better than I have. So if I can do it, I think anyone can.
Yeah, I'm with you. And I will say too, like you said, the pain goes away immediately. It also, a lot of it I know depends on like the area of the body, right? So
Sure.
I think like the big muscle groups, like a lot of the big muscles in the lower back or the quads or something like that, those tend not to be so bad. Like I remember, like I'm a huge baby, and I remember like when we had to just learn the technique of just making sure you're hitting the needle right and all that stuff. They sent you home with a bunch of needles, and you just sat in a chair and just did it on your own quad for that evening. And if I can do
I
that all
didn't
night.
do that part.
Oh, you didn't do that? Oh, yeah, we had to do that. And but I'm saying if I could do that, and again, if my wife's not here, but she would attest, like I am a giant baby when it comes to pain and stuff like that. Then really anybody can. Now we'll always warn people if like, hey, you got a chronic like plantar fascia issue as an example on the bottom of your foot, and you want to try dry needling because it is really effective for it. We'll warn you, it's not going to feel good because that's a really sensitive area. I've had it done. My friend did it to me. I wanted to kill him. So
Yeah.
for the most part, it's really nothing to be worried about. And also the needles, they're called myofilament needles. They're tiny. You can fit like 1 million of them inside of like what you get like your blood taken with, for example. So they're really, really small. And so not really too bad. So with all this being said, right, Kelly, we talked about how, all the benefits that dry needling has, how it stimulates a whole body healing response, you get muscles to relax. All these different things are going to help with a lot of these different issues, whether you have low back soreness, hip tightness, lower body issues like calves, quads, hamstrings, upper trap, if you had neck issues. It helps a lot with headaches, all kinds of stuff. So it has all these benefits, and dry needling is so great. Why do I have to do all this hard exercise stuff? Can't I just come in, get dry needled, and leave? And why do I need to? Why do I need to do the hard stuff after?
Yeah, that's a great question. In my opinion, getting dry needle is hard sometimes. So most people, like I said, do a little better. But dry needling itself is more of a temporary solution that's going to improve your symptoms. It's not going to address the cause of why your symptoms started in the first place. So this is often going to require strengthening or coordination or positioning drills to help ensure that your pain doesn't come back. It's a passive modality. So when we say that, we mean you have to have somebody else do it to you in order for it to be done. So, I mean, you could dry needle yourself, but nobody's going to do that. So you have to rely on another individual to be there and to perform dry needling on you for your symptoms to go away. And one of the big pillars of physical therapy, at least here at CHP, is we want to empower our patients to find ways to get better and maintain their health on their own. So a large thing we want to do is teach our patients home programs, and a home program cannot be dry needling. So that's why you got to do the hard stuff, you got to do the strengthening, you got to do all the drills so that your pain doesn't come back, because at the end of the day, there's probably a bigger cause for your symptoms other than what dry needling is getting after. But the dry needling can help make it easier so that your home program feels better and you can progress a little bit faster, because that tightness and that chronic pain you're feeling can be lesser or gone, and it can make things easier to get through the strengthening and all the hard stuff.
Perfect. Yeah, that's a really, really helpful answer. And it's helpful to hear like the how it's a little more nuanced than I think a lot of people want to see, is because, I think we always want to see like, the black and white answer. Like, is it, do I need to do dry needling, or this manual therapy or massage, or is it exercise the answer? And a lot of times the answer is like a little bit of all the above. And because your body generally won't have symptoms of an issue if there's not a reason for it. And so, we want to figure out what's that reason ultimately, and then be able to address it and hopefully do whatever we can to prevent it from continuing to be a reoccurring issue. But also, like, it helps us better address that or get to that if you're not in pain. So if we can do something like dry needling or a hands-on technique that's going to help get out of pain quicker, and allow us to address the root causes of things, well, then ultimately that's just going to accelerate results in the end. So that's why I always would tell people, if they ask, like, hey, can I just come in for dry needling and that's it? Like, yeah, we can do that, but you're going to have much, much better results if you do that and then follow it with then using this maybe pain-free window we just opened up, or tightness-free window, whatever you want to talk about, to then address, whatever deep down is going on. And hey, maybe then you don't need dry needling again next time because whatever we did stuck a little bit better. So really good context there. Cool. And Kelly, those are really all the questions I had. Is there any other context you want to add out there? Any other questions that you typically get from your peeps, or do you think you feel like we pretty much nailed all of them?
Yeah, I think we got most of it. I'll say the one other common question I get from people is, how many times do I have to do this? Or how frequently do I need to do this? And that's also a really good question. And it's usually specific based on that patient. So I usually give people the window. If it feels better and you liked it, then I would look to do it again, maybe another 2 to 4 weeks. Some people come in, they do it once, the symptoms go away, they don't need it done again. I'm not going to dry needle someone just for the sake of dry needling them, but more so if those symptoms start to creep back up. So it's not uncommon to get dry needle to feel better for a window of time, like you said, whether it's a few days or a few weeks, and then feel those symptoms creep back up. Sometimes it takes a few sessions before we really get rid of those symptoms all in all. So I usually like to give a period of time in between dry needling sessions, just so we can gauge the response. We can get really good strengthening program under us, and see if we can help those symptoms without dry needling. But I'm always willing to do it again if it's something that's providing the patient relief, either with their program or just with their daily life.
Awesome. That's really helpful. Great. So for anybody here, if you have any more questions, obviously about dry needling or anything else that they might have, obviously, as always, you have our contact information. You can always reply directly to the email. If you're getting this via the newsletter, if you're seeing it on YouTube, you probably have our contact information already. And if you're interested in dry needling, contact us at our McLean facility. I know Kelly's doing some great work there, directing that spot. And with that being said, Kelly, I know you're busy. Appreciate you popping in our back room over there to do this. Hopefully, I know we had to move locations today because her colleague Sam was throwing down heavy weights over there. So,
Yeah,
so appreciate you jumping on here, Kelly.
of course.